Welcome to a Mercy Medical Center webinar. I'm Lynn Harmon, Program Coordinator, and today's topic is oral head and neck cancer education. Joining us is Dr. Vincent Reid, Oncology Surgeon at Mercy Medical Center and Medical Director of the Hall-Perrine Cancer Center. Well, I'm very happy to welcome you to our webinar today, Dr. Reid, and I'm going to turn the mic over to you now so we can go ahead and get started.
Hello, I also would like to welcome you to this informational webinar. And today we'll discuss head and neck cancers. We'll talk about, give some ideas to what, these cancers look like, some of the problems that they can cause. We'll talk a little bit about some of the treatment modalities. And certainly we'll spend some time discussing risk factors, because that's really where we can make the most significant impact with regards to head and neck and a lot of other kind of cancers that we treat at the Hall-Perrine Cancer Center is, understanding what those risk factors are, understanding the surveillance, and understanding how we can potentially prevent a lot of these cancers. So when you look at the leading causes of deaths in this country, you will see that cancer ranks right up there at number 2 behind heart disease, and certainly all projections are that within the next 10 years or so, cancer will most likely surpass heart disease as the #1 killer of Americans. This is some idea as to what the anatomy of the head and neck look like. This is kind of a sagittal section, so to speak, where we're looking on from the side and giving some idea of the structures. This would be the tongue, for example, oral cavity, going down into the regions of the oropharynx and down into the airway. The incidence of cancer, if you look at the incidence of cancers, you will not find that head and neck cancer is very high up there in regards to some of the more common cancers, but certainly head and neck cancers are on the rise, and a lot of the things that cause head and neck cancers are significantly preventable kinds of activities and kind of behavioral activities. In men, for example, prostate remains the #1 incidence of cancer, with lung and colon close behind, and in women, you have breast being the most common, with the lung and colon following closely behind. And this kind of mirrors what happens in regards to cancer deaths in the slide, in the images below the slide that we just discussed. As far as head and neck cancers are concerned, there are about 34,000 incidents of head and neck cancers in this country, and with regards to the specific subsites, if you look at the oral cavity, the pharynx, and some of the subsites that we discussed here, the tongue, mouth, pharynx, other oral cavity areas in the larynx, and you have on an annual basis of about 34,000 cases, with approximately 7,500 cases of cancer deaths, with, again, tongue being the most common. And these cancers that we're describing, share similar risk factors, as you will see, and certainly I will keep reiterating that a lot of these risk factors are preventable, and really it is the essence behind the discussion that we're having today. Here you see a patient who has, this is a gauze that the provider is using to expose the tongue. This is a patient who has a tongue cancer at the lateral aspect of the tongue. This is, as you can tell, this would be normal tongue in this region, and here you have this kind of raised, bulky lesion at the lateral aspect of the tongue. A lot of times patients will see this. Sometimes this will get discovered by their primary care physicians, and even at times by their dentists. And this is a cancer of the left lateral tongue in this individual, and presenting some significant problems. We'll talk a little bit about, how some of these cancers are treated. This, for example, this cancer would require a resection of this area with negative margins. With this kind of cancer, you would take like a pizza-shaped wedge of the tongue and removing this cancer, and then close that area. And as you can imagine, if you're taking a pizza-shaped slice of this area and closing it, you will get some foreshortening of the tongue, and this certainly has implications with regards to functionality of the tongue and even with regards to your speech. So this is not without some sequelae. In addition to what you would do locally here to the tongue in this particular patient, you would take the lymph nodes in the neck, because there would be a high incidence of lymph node involvement in the neck of this kind of cancer. So the operation here would be a resection of this area plus a dissection of the neck to look for lymph nodes, thereby staging the patient, making a determination about additional therapy such as chemotherapy and radiation therapy. Here again, this is someone with a lateral tongue cancer. This is seen here. This is probably not as good projected image as the previous image, but here is an individual with a lateral tongue cancer that will require pretty much the same kind of treatment as we discussed. The tongue itself is kind of divided into an oral tongue, which is this part here beyond the papilla, and then the base of the tongue is, as it's called, the base of the tongue. And interestingly, cancers of the oral tongue are mostly treated with surgery and neck dissection, while cancers at the base of the tongue, posteriorly in this area, at the very base of the tongue, those cancers are primarily treated with chemo and radiation. So with regards to the head and neck, particularly the cancers may be treated, the same kinds of cancers may be treated quite differently based on the location. Some of that has to do with how these tumors respond to different kinds of treatment, and some has to do with the implications with regards to functionality, which at times necessitates organ preservation. Here are the cords, your vocal cords, and this is a lesion which biopsy will prove to be a cancer at the kind of the edge of the vocal cord here. And again, treatment for vocal cord cancers can be radical, meaning removing the voice box depending on the stage of the cancer, or it could be radiation. So it depends on the stage. So again, the stage, like most cancers, with head and neck cancers, the stages where the cancer is discovered it has important implications with regards to treatment and subsequent survival. This is a cancer which in North America certainly has, again, biopsy of this lesion will prove to be a cancer, and this is a cancer which in North America has significant implications with regards to survival. These cancers tend to be very, very aggressive in the country. This is a cancer of the inside of the jaw, or the buccal mucosa. And these cancers are usually very bulky and very advanced at the time of presentation. So this kind of cancer usually presents one of the more vexing problems with regards to head and neck cancers, and a challenge in regards to treatment for the head and neck treatment team. That area behind the behind your molars, the portion of the gum behind the molar is called the retromolar trigone, and you can certainly get cancers in that area. This area here, and those kind of cancers are usually require pretty aggressive treatment, because that usually requires resection of that portion of the jaw. Because this, as you can imagine, this is right on top of the jaw of the bone. So it usually requires resection of that portion of the jaw, taking some portion of the floor of the mouth, and a neck dissection. It's a pretty aggressive operation that we call a commando operation, as a common name. And so again, treatment here presents challenges, as you can imagine. The removing this area of the jaw will present with a functional problem, And reconstruction of this area is important. A lot of times we end up having to reconstruct this area with bone from somewhere else. And that lateral bone in the leg, the fibula, portions of that bone is commonly used, and also one of the bones in the arm, the radius, along with the soft tissue bridge to cover the floor of the mouth, is usually used here. These are long, tedious operations requiring multiple specialties, including the head and neck surgery team, the reconstructive plastic surgery team. These are very, very tedious operations. These people present with significant management issues in the postoperative period, and cure rates at times can be low. Lip cancers are usually discovered at a very early stage, since they are so obvious. Since your neighbors will point these things out, your friends and family will point it out that there is a lesion in your lip. So a lot of times, lip cancers has pretty good survival, because for the reason that they are discovered usually pretty early in the process based on the location of these cancers. Tonsil cancer, the two most common cancers up in the head and neck regions are going to be tonsils and base of tongue. There's a very, very large deformed tonsillar fossa on the right side, so this clearly looks abnormal to even the untrained eye. And this would be an example of a tonsil cancer. Tonsil cancers have the ability of being very, very responsive to chemotherapy and radiation. If you remember, we talked about the cancers of the base of tongue before, and like the base of tongue cancers, tonsil cancers are primarily managed with chemotherapy and radiation, with surgery reserved for treatment failure. So tonsil cancer have excellent response to chemoradiation therapy. And when we talk about treatment for cancers, just to we will talk about different modalities. We will talk about surgery, which is cutting it out. We'll talk about radiation, which for lack of a better term is burning it, and then we'll talk about chemotherapy, which attempts to control the disease systemically. So those are the three most common treatment modalities that we'll talk about for most kinds of cancers. And there are other kinds of cancers that are treated, that has hormone therapy, for example, as a part of its treatment. But in general, for cancer treatment, we're talking chemotherapy, radiation, and surgery. One of the things about head and neck cancers is that the risk factors are so exceedingly preventable. Smoking, although overall has been in a decrease in North America, we have seen increases in recent years in certain populations. In college-age women, for example, we've seen increases in smoking. So while we have made significant advances in regards to pointing out the ills of smoking in North America, this continues to be a significant problem, and we've, like I said, seen some troubling spikes in the smoking incidence in certain sections of our population. Cigarette smoke is bad for you. I mean, there's no better way of putting it. It has a lot of, if you break down the contents of cigarettes, it has components which, if injected individually, most of these things will be lethal. So the combination of toxins that is in cigarette is alarming, and the fact that people continue to smoke despite very, very aggressive campaign to point out what these toxins and the kinds of problem that these toxins can cause, it remains one of the more amazing things to me. Nicotine is very addictive, and there's a lot of challenges in regards to smoking cessation. But I think each state has various programs to help individuals with smoking cessation, and so for those of you out there who continue to have difficulty in regards to smoking cessation, you can certainly contact the Hall-Perrine Cancer Center, and there are individuals they're here at our cancer center that will help you navigate that process of quitting smoking. Alcohol is this is not my bar, But alcohol it remains a significant problem with regards to head and neck cancers. And I think that we're not talking here of a glass of wine with dinner, but people who continue to have significant problems with regards to drinking, and particularly binge drinking. So alcohol remains a significant problem in regards to as a risk factor for head and neck cancer. So, we've talked about some of the risk factors: tobacco use, heavy alcohol use, and certainly the risks are multiplied when you combine various risk factors. And ex-smokers, for example, would approach the general population in regards to their risk for head and neck cancers about 20 years after quitting smoking. Cigarette smoke have a 5 to 25 times increased lifetime risk for head and neck cancer when compared to the general population. And it's not just tobacco smoke. Those individuals who use tobacco products in other ways, such as chewing, that is so common in baseball, such as tobacco chewing, those individuals also at increased risk, significantly increased risk of developing head and neck cancers. There are some additional risk factors. This is betel nut chewing, which is popular in some sections of the world. In Northeast Asia, for example, betel nuts, I think are very popular in those areas. Presents a risk factors. People with leukoplakia are at risk factors. And there are certain occupational hazards, such as people who have worked in certain woodworking facilities with exposure to dust and nickel refining facilities. Those individuals are also at increased risks. The human papilloma virus remains the most commonly transmitted sexual virus. It causes a wide range of issues that ranges from genital warts, cervical dysplasias. It causes some severe disease, cancers of the cervix, vagina, vulva, anus, penis. And we now know as significant impact with regards to head and neck cancer. In certain sections of our society, we've seen spikes, for example, in tongue cancer, with direct relationship to the human papilloma virus. Is an example of what the virus looks like. We won't spend too much time talking about this, but as you know, the more concerning subtypes of this virus, has many subtypes of 16, 18, 31, and 33. These are the kinds that are associated with malignancies. The human papilloma virus has over 100 different subtypes. So here's a commonly transmitted sexual disease which has multiple implications, ranging, causing multiple cancers in multiple areas of the body. And this remains a problem. This remains a problem. So it remains a problem in individuals who have a high number of partners. Obviously, people who have increased numbers of oral sex partners are at increased risk. And so all these things that we have talked about, smoking, alcohol use, and unprotected sex, so to speak, these things are all modifiable or preventable behaviors. And so that is, I think, the most important message to get from this little discussion that we're having today about head and neck cancer, is how preventable these risk factors are and how behavior can impact society in general in regards to the incidence of head and neck cancers, and certainly the morbidity and mortality associated with those cancers, and even the treatment of those cancers. So there are a lot of technical slides here that goes into details about certain things that I will kind of just skip through. I wanted to get to the point of talking a little bit about thyroid cancer, which is another one of the cancers that we see in the head and neck. And thyroid cancer in general, and before I get to that, I'll show you some of the pictures in regards to certain treatment. This is somebody who have had a cancer of the upper bone in the jaw, and you can see that this entire area, it was resected. And there's a famous quarterback who's had a kind of cancer and has probably had an operation such as the one that we're looking at here, and this person will have to have a specially fitted device created to kind of fill that defect. And here's a device called an obturator that is created to kind of fill the defect, one, and provide functionality. I mean, when you have all of your dentures and you can do certain basic things such as chew and swallow, one does not think about how difficult it is when there is a missing component and the challenges that those patients have to go through just to do the things that we take for granted, chewing and swallowing, and and obtaining the kind of nutrition that we need to obtain. This is a slide showing some significant inflammation and mucositis, and a lot of times you can see this after you have had radiation, for example. So even the treatment can have significant implication. There is fungal infection associated with radiation treatment, and this can be very, very painful, very, very challenging, and very, very difficult for patients to deal with. So head and neck cancers, it presents some significant challenges. The cancers themselves cause significant problems, but because of the location of a lot of these cancers, because of the importance of the structures that these cancers involve, and the functionality that these structures has regards to our overall survival, even the treatment of these cancers can present with problems. Here is an individual who has had radiation, and you can see that there is exposure of the bone underneath the gum here, and this is called osteoid necrosis. And once this bone starts getting necrotic and starts wearing away, exposing the teeth, there are times when you may even have to have surgery to resect this area, because a lot of times this bone will not heal. So so the points I want to make is one, how troubling these cancers are, the difficulty with treating these cancers. I know not just the cancers themselves, but even the treatment of these cancers can cause a significant problem. But most importantly, if we look at the most significant risk factors that we have discussed so far, the smoking, the drinking, and human papilloma virus, these things can all be impacted by behavioral changes, and I think that's the most important thing. Thyroid cancers, on the other hand, are not so much related to smoking. Thyroid nodules are very, very common in the population. The thyroid cancers have been shown to be related to previous radiation. I showed this slide to show that in around I think February of 1986 was the Chernobyl nuclear disaster, and we saw a spike in thyroid cancers in all of the areas really north of Chernobyl, such as southern Belarus. So this was this showed a direct relationship between radiation exposure and thyroid cancer. Thyroid cancers themselves are certainly not as aggressive as some of the other kind of cancers that we treat in the head and neck region, but it's one of those cancers to be aware of in this region. But these are some of the more manageable cancers, and it's really difficult to put these cancers in the same group as the other cancers. So we won't spend too much time talking about them, just mention them for the purposes of completion. Thank you for listening, and I will turn this back over to Lynn.
Well, thank you, Dr. Reid, for sharing your expertise today. If you have any questions about today's webinar, you can submit them to the website on your screen, mercycare.org/contact-us, and then either Dr. Reid or someone from Mercy will reply to your questions. You can also check our website, mercycare.org/webinars, for information about future webinars and listen to past webinars. So once again, thank you, Dr. Reid, and thank you, our listeners, for joining us today.